I actually have been weight ever since I was about 4 years old. And just all through my childhood, all through my teen years, all through college, after college, and actually probably in the last 15 years is when I really started packing on the pounds. Just blew up about 150 pounds in probably about 2 years' time. Ever since I was little, tried dieting. I would, cut down what I ate, gain it back. When I was in high school, I did, a major program, did well, gained it back. In college, I had a dietitian that lived across the hall, cut out food, did well. Then basically that was kind of my MO all the way along. I would do really well, lose a lot of weight, and then I would gain the weight back. Actually, I'd been wanting surgery for a long time, but my insurance didn't cover it, and so didn't think I would ever be able to do it. And was starting to have some health problems, and my one doctor, she really, is there any way you can do this? Is there any way you can do the surgery? And I was like, I have no idea. The thing that I like most about Dr. Rodriguez is that he's very honest with you. He doesn't sugarcoat things. He didn't sugarcoat things for me at the beginning, but he was very honest and said that he could help me, and that's what I wanted to hear more than anything, was that he could help me. We discussed, different procedures and decided that the vertical sleeve gastrectomy would be the best option for me at the time because I was so large. The day of my surgery, he made sure that he came to see me, even though I was in radiology at the time, getting a PICC line. He met my sisters, talked with them for a little bit, and then he had told the nurses that he had to go out of town on business and he wouldn't be able to see me until the next morning, but to make sure that they told me. Well, about 8 o'clock that night, the door opened and there he was. And I was like, what are you doing here? And he goes, I came to see you. And I go, but the nurses said that you had to go out of town and that you wouldn't be in until the morning, and that was fine. And he said, yeah, but I'm back and I came to see you. So, so that special touch, because he didn't have to do that, but he did do that for me, and I just really appreciated that. My activity level now, as compared to before I had surgery, is night and day. Before surgery, I could barely walk 5 steps without being out of breath. Going upstairs, I avoided at all costs. I would sit and, if I were to go to the grocery store, I would sit and plot and plan how I was going to get through the grocery store without falling over, because I just really didn't want to use those little carts that you can ride on, because that was really embarrassing. But I did use them a couple times. And now, I don't even think about what I do. I just go. I can walk almost 2 miles without a problem. I can swim a little over a mile without a problem. I do water aerobic classes, and usually I'll swim for half an hour before the water aerobic class, and the water aerobic class is an hour. I can just go and do. You are worth all of this. You are worth all the aches and pains that you're going to have to go through. You're worth the surgery. You're worth everything. There is nothing that should keep you from having the surgery. You should look online. There's so many different procedures out there that you can have done. Life is worth living. It's not worth letting it pass you by. And I just hope that, if this can help you even just a little bit, that would be great. That would be just an answer to prayer for me, because I just would like to touch one person.